Record. Hi, I'm Chelsea from the Truro Council on Aging, and today with us we have Rita Mitchell, who's going to do a presentation on tick-borne diseases in the older adults. Hi Rita, how are you today?
I'm good, Chelsea. How are you doing?
Good, thanks. So can you tell us a little bit about yourself and how you got into this?
Sure. Rita Mitchell, I'm an RN. I've been a public health nurse now for over 20 years.
Okay.
Worked full-time for Barnstable County Department of Health and Environment for 11 years, and then I've been per diem since then. But 20 years ago is when I started the education program on ticks and tick-borne diseases for the county. And during that time, I have talked to adults, I have talked to kids as young as 3 years old. We have a program for all ages. So I'm very happy to be with your group today.
Great, well thank you. We're excited to have you.
Okay, so I'm going to try to bring up my PowerPoint.
Okay, awesome.
And
that'll help direct us through and give us some information.
Happy to do that. So we're going to talk about Lyme disease and tick-borne illnesses, the effects on the older adult. And this is on behalf of Barnstable County Department of Health and Environment.
Awesome, thank you.
So our objectives today is to have a better understanding of the known tick-borne illnesses in the U.S. with a focus on Lyme disease and babesiosis, history of these illnesses and pathophysiological view of the bacteria and vectors, the implications of age and physiological changes with respect to Lyme disease and babesiosis. And I'm a senior citizen too, so I'm there with all of you. And lastly, we'll go over some things we can do to protect yourself.
Awesome, thank you.
This is a picture of the deer tick, also called the black-legged tick. And if it was this big, we'd have no trouble finding it.
But it's very, very
small.
We can't see the screen.
You can't see the screen. Oh, I just lost everything.
All right, so if you want to flip your screen, Rita, and show us your PowerPoint, that would be great.
Okay. How does that look?
Awesome, perfect.
Oh, okay, so Lyme disease and tick-borne illnesses, the effect on the older adult. Our objectives are to have a better understanding of the known tick-borne illnesses in the U.S. with the focus on Lyme disease and babesiosis. A history of the illnesses with pathophysiological view of the bacteria and vectors, and the implications of age and physiological changes with respect to Lyme disease and babesiosis. And I'm a senior myself, so I know where we are. And lastly, how to protect yourself and your families. This is not just about you. It's about all your family.
Yes.
So this is the deer tick. It's also called the black-legged tick. And if it was this big, we'd be able to see it very easily. But of course, it's much, much smaller. And we'll go into that later in the slideshow. Here's a picture of the dog tick, which I'm sure you've seen, especially if you have a pet. And this is the Lone Star tick. This is the new one that we have, although we've had it now for a number of years. And they all can carry different diseases, but some of the diseases we see more frequently than others. Okay, the illness is anaplasmosis, and that's carried by the deer tick. Babesiosis carried by the deer tick. Ehrlichiosis by the Lone Star tick, but we don't see it very often. Lyme disease, which we all know about and we'll learn more about today, the deer tick again. Rocky Mountain spotted fever by the dog tick, and we do not see many cases of that in Massachusetts. It's very, very seldom that we see it. Southern tick-associated rash illness is carried by the Lone Star tick, but we don't see that often either. And tularemia can be carried by the dog tick and the Lone Star tick, but again, they're not ones that we see very often in Massachusetts, which is good. So a little bit about the tick life cycle, because this gives us some wonderful information. A full life for a tick, if it makes it through its whole life, is only 2 years. So in the spring, the mother tick delivers her eggs, and she can deliver 2,000 to 3,000 eggs.
Wow.
Very prolific. And the eggs come out and they have no disease in them. And then they turn in the summertime to larvae, and the larva can catch the disease from its first blood meal. It only eats 3 times in its life, but that first blood meal is usually on something small like a mouse or a bird. And if that mouse or bird are carrying the bacteria for Lyme or babesiosis, then the tick picks it up. The following spring, the tick morphs into the nymph stage. Now the nymphs, about 25% of them are going to be infected with Lyme. When it comes to the adult stage, about 50% are infected. So the nymph has its next blood meal, and of course, it can pick up the disease at that time also. It goes through the whole sequence again, and in the following spring, the mother delivers the eggs, and then she dies. If I delivered 3,000 eggs, I think I would die too. So the adult tick is about the size of a sesame seed. The nymph tick is the size of a poppy seed. So it kind of shows with these bagels what we're talking about. And one of the things that's difficult, it's hard to see them, even if our eyesight is really, really good. But if you have any problems with your eyesight, you might need to use a magnifying glass or something like that to really get a good look at it. I had a tick in me one time, and really I had to get a magnifying glass, and I saw the little legs moving around. I went, okay.
Yep.
This is the tick hypostome, this barbed area in the center of the tick. That's the tick's mouth part, and that's the only part that goes into you. But it has some interesting properties. It can stay attached up to a week, so it's got a glue-like substance in the saliva. It also keeps the white blood cells from coming and destroying it, which is something else that normally if we have a cut, the white blood cells rush to that area. Mm-hmm. And also it keeps the blood flowing. If you got a tiny little prick, you know it's going to stop bleeding pretty soon unless you have a problem. But with the tick, that tiny little bit of blood can keep flowing, and the blood comes in and then the saliva comes out. Okay, so it's just that middle barbed area that goes into us, not the whole tick. When and where do we find ticks? Any type of tall grass, bunches of leaves, garden if there's high area and it's shaded, or our dogs. How do ticks move around? Well, ticks don't fly, they don't jump, and they don't fall out of trees. They get to the end of the grass or the leaf litter, and what they do is something called questing, where they move their arms, their legs, looking for a blood meal. And what they're looking for is something that's putting off carbon dioxide, which could be a human or could be an animal. And then they get on, and they usually go up on us to someplace kind of shaded and moist, like the backs of the knees, groin, under the arms, under the breasts, around the ears, those areas they really, really enjoy. So what is Lyme disease? Well, it's the most common of tick-borne illnesses, and it's been called the great imitator, as it mimics other illnesses in its broad clinical presentations. So some of the different illnesses that it can look like: mental illness, fibromyalgia, chronic fatigue syndrome, hypochondria, ALS, multiple sclerosis, ADHD, rheumatoid arthritis, and depression.
Wow, that's very interesting.
And when people get the symptoms of Lyme, they don't always get all the symptoms. We're going to go over that in a short while. Now, Lyme disease was initially discovered in 1975 in Lyme, Connecticut, where a mother noticed that a number of children in her neighborhood had juvenile arthritis. And she thought that was really strange. And she brought it to the attention of the doctors that there was this group of kids that had this particular illness. And what it was Lyme disease. And she was from Lyme, Connecticut. So that's where we get the name Lyme disease.
Interesting.
There's an early history of it going back from 1975, documented 5,300 years ago. So ticks have been around for a long, long time. Mm-hmm. This is just an interesting picture of cases of Lyme disease. Each case is supposed to be one dot, and you can see in New England, we have a lot of dots.
Wow.
Okay. Now, one of the symptoms that about 50% of the people get is the rash. It's called an erythema migrans rash or a red rash, and often it looks like a bullseye. And what happens is it actually spreads over a few days. If you go to see the doctor and he thinks maybe you have a Lyme rash, very often he'll make a mark around it with a marker and have you come back a day or two later. If the rash has grown, he knows you have an erythema migrans rash. So I always say, if you're unlucky enough to get Lyme, hopefully you're lucky enough to get the rash, because people really understand that and know it and know to get help.
Huh.
Treatment is doxycycline or amoxicillin, and usually you're on it for a number of weeks. And sometimes the chronic Lyme can occur where you're on it for a long period of time. Now, babesiosis can be a severe life-threatening disease, especially if a person doesn't have a spleen or they have a weak immune system, other health conditions, or are elderly. The babesiosis, it attacks the red blood cells. Now, from the 2017, these are the most recent statistics that the state has, 590 confirmed and probable cases of babesiosis in our state. Confirmed cases had increased 13% from 2016, and overall 1,677 suspect cases of babesiosis were investigated. So we're seeing more of this. People over the age of 60 continue to be at greatest risk for clinical disease, with 59% of all patients identified with babesiosis being over 60, and over half of them, 66%, were males.
Wow.
Now, whether they're outdoors more or in the area to be exposed to the ticks, that would be my guess. And I think with people that are older, it's harder to find the ticks on ourselves, and that could be why that's higher.
Huh.
Approximately 1 out of 3 patients with babesiosis was hospitalized, and there were 4 fatalities. 4 confirmed cases were associated with getting a blood transfusion. That can be spread that way. It's very unusual, but it can happen. Symptoms and treatment of babesiosis are fever, chills, headache, achy joints and muscles, fatigue, nausea and vomiting, abdominal pain, dark-colored urine, and the treatment is clindamycin and quinine. This shows the different cases that they had. The blue shows the confirmed cases. And you can see in age 85 and up, that number is just getting up there, but especially 70 to 74, 65 to 69. You can see the cases in the younger ages is much less.
Wow, that's interesting.
Transfusion transmitted. This shows you the transfusion ones since 2009. With increasing age, a number of risks pose the aging adult to complications related to tick-borne illnesses, both physiological and psychological. Physiological changes, there's a decreased functioning of our senses, whether it's the touch, whether it's sight. Skin integrity becomes compromised as the skin loses its elasticity. We have a lot more bumps and bruises and things that we feel when we check our skin for ticks. There can be psychological changes where you may have difficulty performing whole body examinations due to physiological changes in perception, vision, acuity, or lack of help. You know, if you're a single person and you don't have a spouse there or a friend to help you, it's very hard to check certain areas. Children and older adults are at greater risk for complications related to tick-borne illness exposure. And that one of the reasons is immunological function is decreased in children as well as in older adults. So what can we do to protect ourselves? And this is for all ages. Walk in the middle of trails, away from tall grass and bushes. So if you're going on a trail, stay on the trail instead of on the side. Wear a long sleeve shirt. Wear white or light colored clothing to make it easier to see ticks. When I do this talk with the little kids, I always have someone who's wearing light colored pants stand up, and I usually have dark colored pants, and I'll say, no, if there was a tick on On Susie here, would you see it easier on Susie or me? Wear a hat, spray tick repellent on clothes and shoes before entering woods, and we'll go a little more into that in the coming slides. Wear long pants tucked into high socks, and wear shoes, no bare feet or sandals. These are all areas, things to do that you can keep the tick from getting on you. Lyme disease is out there, ticks are out there if it's over freezing. So even in the wintertime, we can find ticks. Do a daily tick check. Check your body daily for ticks. Feel with your hands for tiny bumps or scabs that weren't there the day before. Use a magnifier to check, and this one habit can save your life. It's really important. Yeah. Most important thing we can say today. Repellents. Some people like to use repellents, others don't, but it's important to look at the active ingredient. Products with DEET, and I'm not going to try to say that big long name, N-N-diethylenolumide or permethrin are recommended for protection against ticks. There are some repellents such as picaridine or oil of lemon or eucalyptus. They've been found to provide protection against mosquitoes, but they have not been shown to work well against ticks. Permethrin is something that's intended not for the skin at all. To put permethrin on your clothes or your shoes, you would go outside, put them on a clothesline, spray it, and let it dry. You actually can buy clothes now that have permethrin in them that are good for a number of washings.
Wow.
If you look online, EMS Sports, I know, has them, possibly some of the other big stores that have things for camping and hiking gear. It should never be applied to the skin, and put them on your clothes first. And always follow the product directions, no matter which you might be using. Now, the removal of a tick, people come up with some very inventive ways to remove ticks. The only really good way is with fine point forceps, tweezers. Mm-hmm. You put your tweezers right near the skin where the mouth of the tick is going in, and you pull back with a steady, even pressure. Put it in a resealable plastic bag and throw it out in the trash, unless you're saving it to be tested. We have a special program, thanks to Cape Cod Healthcare, where people who live on the Cape can send their tick in to be tested to the lab at UMass for a very, very small amount of money compared to what it would be if you weren't living on the Cape, because we have so much here. But it's best to not twist them, poke, squash, or burn them. Don't smother them with lotion or toothpaste or anything like that. It just makes the tick angry. And it would possibly put more of the germ into you in the process. Oh. Questions? Now, I know I can't answer questions on this, but if you have any questions, I suggest that you call Barnstable County Department of Health and Environment. My boss is Deidre Arvidsson. She's the public health nurse for the Cape now, and she's just as knowledgeable as I am, but I very much appreciate being able to talk to you all, and I hope that no ticks get on you. But if they do, you know what to do.
Great. And if you could provide me with that information, anybody who has any further questions could also contact the COA, and I could help direct them as well if that works. So
very good.
Awesome. Well, thank you for your time today, Rita. We appreciate it.
Oh, you're welcome. It was a pleasure. It's a great way of doing things. I would like to see them in person, maybe next year.
Yes, maybe next year. Yes. All right. And thanks again to everybody for watching, and we'll see you soon.
Bye-bye.
Bye.